The lines are long, the patience is wearing thin. Many are still being forced to drive hundreds of miles just to get a COVID vaccine. Tonight, with hundreds of thousands of you trying any avenue you can to get a shot, there are allegations of line jumping by a top St. Louis County health leader.
This employee's husband didn't have an appointment to get a vaccine. Only investigator Lauren Traeger goes straight to the top to ask, is this favoritism or just an opportunity?
It's an abuse of power, and it's really an issue that she used her privilege to get her husband vaccinated.
This St. Louis County Health Department employee spoke with us anonymously.
I'm concerned about my job, specifically my livelihood.
The employee says on February 8th, Spring Schmidt, at the time the co-director of the county health department, got her shot, but with her husband. Signs around the health department say no walk-ins. You must have an appointment, but he did not.
Do you feel like you can say for sure that you know he got the vaccine?
Yes, it's her bringing her spouse, like family and friends day at a discount store.
This employee says it put them in an uncomfortable position.
She asked, can I get my spouse vaccinated too? Well, are we supposed to say no to our director of the health department?
It was not unethical. It was not inappropriate.
Dr. Faisal Khan now heads the county health department as of Monday. Schmidt, who was only interim, is now the deputy director.
I have investigated the matter and have reached the conclusion that this was pure happenstance. It was misconstrued and misrepresented as something else.
Khan says Schmidt's husband was with her to drive her home at the end of the day.
She was informed that there were 3 or 4 doses left over. And at that point, somebody said, hey, you know what? Your husband is eligible. Why don't we give you those? And she checked and made sure doubly that it was okay. It wasn't reserved for anybody else. That's how it happened.
County protocol, he says, allows for employees' family members to receive leftover doses that otherwise would go to waste, but only if they are pre-registered and in an eligible tier. Khan says the husband was both.
If this person was not part of the group that met the eligibility criteria, that conversation would not have taken place at all.
What would you say to somebody who says it looks at least like she may have taken advantage of the system, knowing what she knew?
No, that is not true. That is not correct. There is no jumping the queue. There is no getting ahead in line. And just because you happen to work for the county or know somebody who works for the county doesn't mean you're going to be allowed to jump the queue. In fact, our instructions to staff are very clear. Nobody gets to jump the line.
The public already does not trust the government.
But at a time when so many people are desperate for a vaccine, this employee says the public is right to question.
We work for the people. We're public servants. So yes, I do believe that they should know.
Dr. Khan says they do not encourage people to come to the health department at the end of the day to see if vaccine is left over, which he says is rare. Still, he adamantly stands by what happened, saying it is exactly what is happening in vaccine distribution in both the private and public sector. If there's vaccine about to go in the garbage, get it in an arm instead. Want to reach out to me about this? You can email me at investigates@kmov.com. I'm Lauren Traeger, News 4 Investigates.